Hello, my name is Brent Hurley. I am the Division Director for the Division of Adult Community Mental Health Services at the Department of Mental Health. Mississippi Department of Mental Health provides hope by supporting a continuum of care for people with mental illness, intellectual or developmental disabilities, and alcohol and drug addiction. Services are provided through our state-operated programs and community service programs, regional community mental health centers, and other nonprofit or profit service agencies and organizations. Adult mental health services, core services, are some of our core services are psychosocial rehabilitation programs, outpatient therapy, community support services, peer support services, psychiatric and physician services, and crisis response services. Psychosocial rehabilitation programs are a network of services designed to support and restore community functioning and well-being. And the purpose of the program is to promote recovery, resiliency, and empowerment of the individual in their community. Outpatient therapy, psychosocial rehabilitation programs can be found in Chapter 24 of our operational standards. Outpatient therapy includes individual, group, and family therapies, and it can be found in Chapter 22 of the operational standards. And it is intentional face-to-face interactions between a mental health therapist and an individual, family, or group where therapeutic relationship is established to help resolve symptoms of major mental and/or emotional disturbances. Community support services, which can be found in Chapter 20 of the organizational standards, is an array of support services delivered by community-based mobile community support specialists focused on an individual's ability to succeed in the community. And the majority of those services are provided in the community rather than office setting. We also have peer support services, which can be found in Chapter 42 of the operational standards. And a certified peer support specialist, or CPSS, is a family member and or an individual who has self-identified as having received or presently receiving behavioral health services. Additionally, a certified peer support specialist has successfully completed formal training recognized by the Department of Mental Health and is employed by a DMH certified provider. Then psychiatric physician services, which can be found in Chapter 21 of the organizational standards, are interventions of medical nature provided by medically trained staff to address medical conditions related to the individual's mental illness or emotional disturbance. Medical services include medication evaluation and monitoring, nurse assessment, medication injection. Services must be provided within 14 days of an initial assessment of the individual. And then crisis response services, which can be found in Chapter 19 of the operational standards, is where DMH providers must provide a 24-hour crisis number to all clients that they serve and ensure that one of their staff is available to speak to individuals in crisis or a family member at all times. Intensive community services that we now have available in every county in Mississippi include PACT and I-Court programs and intensive community support services. PACT are programs of assertive community treatment, and I-Court is intensive community outreach and recovery team. Their service is delivered by a group of multidisciplinary mental health personnel who work as a team and provide a majority of the treatment and rehabilitation and support services people need to achieve their goals. The majority of these services are provided in the community where the individuals live or where they can be found. PACT teams have a ratio of 10 clients to each staff member on the team. I-Court has a ratio of 15 clients to each staff member that's on the team. Intensive Community Support Services, or ICSS, is very similar to community support services that we discussed in the last slide, but they maintain an unusually low caseload, providing services multiple times per week as needed and providing interventions primarily in the community rather than the office settings. As I said, one of these services is available in every county in the state of Mississippi, and they are provided by your local community mental health center or CMHC-C. Treatment planning utilizes approaches considered to be best practice or evidence-based, and they need to be person-centered, and they need to have wraparound services. When planning a course of treatment for our clients, it is important to remember that you should tailor your services to fit the needs of the client rather than fit the client in the services that you're certified for. An example of that is if you provide supervised living or group home services, clients shouldn't have to go to another one of your programs like PSR during the day because you don't have enough staff. Clients should have options like go into work or school during the day as long as they have a meaningful day. The treatment planning must utilize a team approach that includes individual services and other providers of support can be identified by the individual or the family. Focus on recovery and resiliency, be person-centered, be strengths-based, and include career development goals for individuals in day programs. It could also include proactive crisis planning. Crisis plans are very important for most of our clients to have just so that we can keep them from having to go inpatient or to a state hospital and go through the commitment process. We have supported employment specialists all over the state now as well. We have a great relationship working with Voc Rehab to help us get more employment for adults with serious mental illness. You can start if you have an individual that wants to include career development goals in their treatment plan. You can reach out to your local CMHC and find out who the supported employment specialist is, or you can reach out to Voc Rehab. The record guide is a good place to find documentation required by DMH for planning and evaluating the services that you provide. You can find the record guide at the website listed here, and you can find the operational standards listed on the website provided right there too. And if you have any information about adult mental health services, here's my name and phone number as well as my email address. You can contact me at either of these points of contact.